Radio Sussex.
2- and 3-year-olds are among the children being referred to the first clinic of its kind in Sussex, which aims to tackle childhood obesity. 58 youngsters have now been seen at the Complications from Excess Weight Clinic since it opened at the Royal Alexandra Children's Hospital in Brighton in 2022. It's one of the 30 specialist pilot clinics across the country. Our reporter Alex Bish has had exclusive access.
Hello there, good afternoon. You've come through to the Complications of Excess Weight Clinic. What can I do for you?
My name is Dr. Shankar Kanumakala. I am one of the people who is involved with Q or CEW.
So this is one of 30 pilot sites that have been set up around the country. This serves children here in Sussex. What age groups are you seeing and what conditions do they have?
Generally, we see children from as young as 2 or 3 years of age to approximately 17, 18 years of age. If you think about a child who is supposed to be 20 kilograms, is 40 kilograms, then that child has 100% excess weight.
Are you seeing illnesses that you'd expect in adulthood, now in children?
Yes, of course. One of the most commonest things is diabetes. It actually decreases the lifespan of the child to a significant extent. And that is really, really sad.
What's different about this facility?
We are looking at lifestyle measures, which is decreasing the unnecessary calorie intake, improving their physical activity levels through the physiotherapist and the psychologist, giving them resilience or helping them to be resilient with the help of the psychologist, and at the same time, active.
Hi, my name's Jo Lord. I'm a senior paediatric physiotherapist. Usually the young people will come across to see me after they've been in clinic.
There's been a big discussion about activity levels or inactivity.
It's really, really common. I think our experience as a physio department as a whole is that unless you've got children who are particularly into their sports, so they're out training a lot, the general feel is that a lot of children are not. They're at home, they're on their games, streaming TV 24/7, so it's really, really difficult. It's a society issue. It's the way we're living now. It's the way we're producing and providing food, how easy it is to get cheap, unhealthy food, and for families that's really, really difficult decisions for them to make. We're working with the young people and their families, but really the change has to come at a wider, governmental level, I would say.
So what is fueling the obesity crisis? How much is linked to junk food and inactivity? And is the cost of food a factor? These parents say it is an issue for them.
I mean, it's a lot more expensive to cook healthy, but it has to be done, doesn't it? But not everyone's got the money to be able to do it.
It's easier to buy junk food.
I'm a single parent, so it's really difficult for me to afford to eat healthy and do stuff for Logan every day. So it's just, it's really difficult.
We've already seen a sugar tax, but some campaigners want the new government to go further.
I'm Professor Keith Godfrey from the University of Southampton. So the sugar tax has definitely been helpful in reducing sugar intakes in the UK. But we absolutely need to do much more than that. We need to promote physical activity, give children the space to be more physically active, to make streets safer for them to walk and cycle in. We need a real national mission to take this forwards.
The government says it will introduce tight restrictions on advertising junk food, alongside banning children from being able to purchase sugary, high-caffeine energy drinks. Meanwhile, the clinic in Brighton is hoping to expand in future to work with more children. Here's Dr. Shankar again.
It is a pilot program, and we are only seeing a small number of people at this point in time. The good news is there are discussions in order to make this one a permanent feature. And there are discussions in order to protect the funding for this pilot project into the future so that more number of children can be helped.
Alex Bish with that report, and listening to it, Dr. CLA Snowden, paediatrician at University Hospitals Sussex. Dr. Snowden, good morning.
Good morning.
Can we talk more about this? What sort of main age groups are you seeing, and how severe are some of the weight problems you see?
Well, as Dr. Kanumakala said, we
can see children as young as 3. Most of the children in our clinic at present are 7 and above, up to 17, 18 when we progress them onto adult care. The complications can include insulin resistance, which is kind of a step before type 2 diabetes. We see a metabolic fatty liver disease, which again is related to the excess weight that the body carries. Children can have obstructive sleep apnea, which means that when they're asleep, they obstruct their airway temporarily. They can have conditions called intracranial idiopathic hypertension, which can lead to vision loss. And that's just a short list of some of the many complications they can experience.
And we were hearing some of the reasons for that in Alex's report there. But how does this team that you work with treat the children and support their families?
Well, we are a multidisciplinary team. So Dr. Kenna McCullough and Joe are physiotherapists. We also have we have a dietitian, Joe, a psychologist, Sally, and our administrator. And we will be soon employing a specialist nurse. We also have safeguarding nurses involved and hope to get a youth worker in the future. The aim of the clinic is very much supporting the families through learning about their child, what's going to work for their child. We look at the dietary needs of that child. We look at how our societal changes have impacted the foods that that family is eating and how best can we advise them to alter that plan to support their child's health. That does include things like looking at portion sizes, looking at ultra-processed foods, understanding the emotional eating and behavioral patterns around food for that child. And we work over a year or two on these factors. This is a kind of a longer term plan for the families. We don't expect quick change, but the ultimate goal is to remove the excess weight. And with that, we see that the medical complications start to go away.
Thank you very much for now. Dr. Claire Snowden there, paediatrician at University Hospitals, Sussex.